Hello everyone and welcome back to my channel Medicine by Dr. Rajesh. So again I have come with a very serious yet common condition in our country. Common echocardiographic features I would say. It is patients of pericardial effusion. Now we know that pericardial effusion is a very life-threatening condition if the patient lands up in cardiac tamponade. So let us quickly, without wasting time, see what are the common echocardiographic features once you put a probe on any patient who is suffering from pericardial effusion. So let us go straight to the echo machine. This is an image of a patient having pericardial effusion. You can clearly see this is the left ventricle, this is the right ventricle. This echo-free space, which is plenty, is the pericardial fluid. On echo, how do we say it is pericardial effusion? This round structure is the descending thoracic aorta. Any fluid which is anterior to this, means in front of this, is pericardial effusion. Any fluid which is posterior to the aorta is pleural effusion. So this is a heart which is surrounded by large amount of fluid. Plus, I would say, you can see this right ventricle which is collapsing with each beat. But mind it, to say that the patient has pericardial tamponade, this collapse has to be in diastole. Whereas in this case, the heart, the right ventricle, although collapsing, is collapsing in systole, which is a normal phenomenon. Had this collapse been in diastole, I would have thought that this patient is in pericardial tamponade and would have taken her immediately for a pericardiocentesis to save the life of this patient. Let us see the other features. I will go to the 4-chamber view where you can see that this heart is totally lying inside the pericardial fluid. If the pericardial effusion increases further, the heart will start swinging inside the fluid, and that is called as a swinging heart. When you take ECG of this patient or when you search for the pulse, you can see electrical alternates because now the heart is swinging. So the electrical impulses will also change, and on ECG it is called as the electrical alternates. If I show you the mitral inflow pattern, there is a variation in the mitral inflow in cases of pericardial tamponade, means some of the mitral waves will be small and some of the mitral waves will be very large depending upon which phase of respiration that is. Here it is absent in our patient. Had that been present, it again qualifies the patient for cardiac tamponade. Lastly, what I will show is the subcostal view of the patient, which is usually the first image that you would like to take in any patient who comes to you in the casualty. Taking a subcostal view in the casualty makes the job very easy as far as pericardial tamponade is concerned because you become alert after seeing this. By definition, any fluid which is 20 millimeter or more in diastole across the left ventricle is severe pericardial effusion. Similarly, any fluid across the right atrium or the right ventricle in diastole, if it is more than 10 mm, it is severe pericardial effusion. So I hope these small tips, although not in details, would help you in future to diagnose pericardial effusion right at the moment when the patient comes to your casualty. So keep following me in my channel. I'll come up with new echoes very soon. Thank you for your kind attention.